Welcome to The Explainer. Today, we're taking a fascinating peek behind the counter of your local pharmacy. If you've ever found yourself wondering how these absolute drug retail giants manage their incredible energy needs, their highly sensitive health data, and those super complex supply chains, well, you are definitely in the right place.
All right, let's kick things off by defining exactly what we mean when we say drug retailers, or the HCDR classification within the healthcare sector. Under the Sustainable Industry Classification System, or SICS, we aren't just talking about your neighborhood mom-and-pop shop. No, we're looking at massive entities operating vast retail pharmacies and distribution centers. They are sourcing merchandise through huge wholesalers and distributors to sell pharmaceutical products directly to consumers.
Now, to figure out how these giant networks are actually measured, we're going to ground our explainer in the rigorous SASB standards, which are now overseen by the IFRS Foundation. These aren't just vague corporate promises, right? They are strict, highly trackable accounting metrics used to gauge a company's true operational risk.
To unpack all of this, we're going to look at 6 key areas today: the business model, energy management, data security, supply chain integrity, controlled substances, and finally, patient outcomes.
Section 1. The Drug Retailer Business Model.
If we look at the macro structure of how these massive entities operate, it's really a vast, continuous flow of merchandise. Step 1, it starts with large pharmaceutical wholesalers and distributors. Then, Step 2, that product funnels into huge regional distribution centers. And finally, Step 3, it lands right on the retail shelves or in walk-in clinics.
But, before we even look at the risks, we really have to grasp the sheer scale we're dealing with here. Retailers have to report their baseline activity metrics. We're talking the total number of pharmacy locations, the aggregate square meters of retail space, the millions of prescriptions filled, and the literal army of pharmacists they have on staff.
Moving on to Section 2, Energy Management in Retail.
So powering those thousands of physical locations, that's our first major operational risk. I mean, just think about it. You have these massive refrigeration units for medications running 24/7, alongside constant, intensive lighting. The energy consumption is just staggering. Because of this, retailers must track their total energy use in gigajoules, and crucially, they're required to report the exact percentage pulled from the grid versus what comes from renewable sources.
Next up, Section 3. Data Security and Privacy.
Okay, transitioning from the physical stores to the digital realm, we had a massive vulnerability for drug retailers. The standard actually makes a very strict legal distinction here between standard personal data, like your identity or credit card number when you buy toothpaste, and highly sensitive health data. Health data reveals your physical or mental status, and protecting that requires far more stringent safeguards.
Because the stakes are just incredibly high. Retailers absolutely must report exactly how many data breaches occur. But they also have to break down what was exposed. Was it standard personal data, or is it that sensitive health data? They have to disclose the total number of unique customers affected, the direct monetary losses from legal proceedings, and most importantly, the mandatory corrective actions they took to ensure it never happens again.
Which brings us to Section 4, Securing the Supply Chain.
Zooming back out to the physical products, keeping that long supply chain secure is absolutely paramount. The framework requires very explicit, transparent efforts to fight severe threats like counterfeit drugs. These are drugs that might lack the active ingredient entirely, they might contain the wrong quantity, or they might just be sitting in fake packaging. Literally one compromised drug on a shelf can destroy a brand's value overnight and, worse, severely harm patients.
So, to build a fortress against these kinds of threats, retailers have to detail their defenses. This means rigorous vendor inspections and audits, advanced traceability and barcoding systems, automated alerts, and direct coordination with law enforcement. They also have to show how they manage these risks differently for national brands versus their own highly profitable private label products.
But what happens when those defenses actually fail? Well, the standard mandates tracking the exact volume of product safety recalls. This isn't just about noting that a recall happened. It's about quantifying the total units affected and pulled from the market, paying very special attention to the percentage of those units that were the retailer's own private label products.
All right, Section 5, Management of Controlled Substances. Now we need to examine the most highly regulated items sitting on the pharmacy shelf, controlled substances. With such incredibly high volumes being processed, strong internal controls are vital to prevent theft and illegal dispensing. Mismanaging this doesn't just mean lost inventory, right? It leads to severe adverse public health consequences, like drug abuse. Because of this, companies must fully disclose all monetary liabilities and fines resulting from regulators. So, we've tracked the product through the whole business model, from the wholesaler to the distribution center, through the energy-intensive stores, and past the rigorous security checks. But what actually happens after the drug leaves the pharmacy counter? The sustainability standards don't just stop at the cash register.
That leads us to our final area, Section 6, Patient Health Outcomes.
This final operational pillar focuses purely on the human element. The pharmacist is really the last healthcare touchpoint before a medication is consumed. Retailers must disclose the practices they've implemented, like barcoding and data verification, to prevent dispensing errors. Handing a patient the wrong medicine or dosage is a catastrophic failure. So companies must report the financial fallout from dispensing lawsuits, as well as the corrective actions and retraining programs used for their pharmacy staff.
Ultimately, pharmacies are measured on patient health through something called the first fill adherence rate. This is a percentage showing how many prescriptions that required a refill were actually refilled at least once after the initial fill. It's really the ultimate test of whether a pharmacy's refill reminders and staff engagement are working to ensure patients are actually taking their prescribed therapies. Good adherence is great for the patient, and frankly, it's great for business.
So when you pull all of these elements together, from the gigajoules of energy and the data breach statistics to the recall volumes and patient adherence rates, these metrics transform what could be abstract operational risks into a concrete, highly trackable blueprint for the entire industry. It really gives us a clear window into how well a drug retailer is actually managed.
But of course, the industry isn't just standing still. As these massive entities evolve beyond traditional pharmacies into fully operational walk-in health clinics, we have to ask, how will taking on more direct patient care completely rewrite their sustainability risks and data vulnerabilities in the near future? It's a truly fascinating evolution. Thank you so much for joining me on this explainer.